On-the-scene coverage of ACC.14 is supported by Janssen Pharmaceuticals Incorporated.
We're here for On the Scene at ACC at the annual meeting in Washington, D.C., and the late-breaking clinical trials continue to roll out. I'm here with Mike Korn from Jacksonville, Florida, and Mike has done a study on anti-PCSK9, which may in fact be an answer for patients that are statin intolerant. Mike, tell me about the study.
Sure, thanks Peter. The study is called MENDEL-2, and it's a study of Evolocumab, which is a monoclonal antibody, fully human monoclonal antibody directed against PCSK9. And the study looked at patients who are not on statin therapy. Actually, the reason we're doing this study is to understand the drug better in a phase 3 clinical trial. A lot of people don't know this, but statins actually raise PCSK9 levels. So it's important to do studies of these type of drugs both with patients on statins and with patients off statins so we can compare the safety and efficacy with the two different type of patient populations.
Okay, so the study patients that you used, low risk patients, high risk patients, what are they?
Lower risk patients who did not necessarily need to be on statins.
Okay, so having said all of that introduction, yes. What'd you find?
We found that Evolocumab was quite safe and effective. We saw an average LDL cholesterol lowering without statins of 57%, compared to Ezetimibe, which was a 18% reduction as a comparator, or virtually no change in the patients treated with placebo. And we also looked at biweekly and monthly dosing regimens. We found great equivalence between the two dosing regimens.
Okay, so I guess as a cardiologist I have to say, okay, LDL comes down, what happens to HDL?
HDL increased slightly using the Evolocumab, statistically significant compared to Ezetimibe or placebo, about 6 to 8%.
So actually that's in the good direction. We all like to see that. That's a little bit different than a lot of the statins which don't do very much, exactly. Isn't that correct?
Exactly.
Okay, so having said all of that, now we've got an anti-PCSK9 drug that seems to work. What do you think this means, and where do you think this is going?
So we understand that the primary population for this type of therapy isn't in low-risk patients. However, there are some patients that can't take statins, statin-intolerant patients being one type of patient, or patients that are on another drug and have drug-drug interaction issues with statins, or patients that just can't be tolerant with oral medicine every day for whatever reasons. So we think that there are a couple of very interesting niche populations who will be monotherapy populations for drugs like Evolocumab. However, having said that, we think for most patients this will be an add-on therapy to full doses of statins for people at very high risk, such as patients with familial hypercholesterolemic.
You know, I tell you, for me though, Mike, for all those patients out there that can't tolerate statins, that get the muscular aches and so forth, and for the docs taking care of them, here's something to keep your eye on. Thank you.
Absolutely. Thank you, Peter.